Good. Well, welcome everyone. Welcome. This is our final session of the day. And last but certainly not least, we have this incredible session on the importance of clinical trials for autoimmunity. And it is so wonderful to have with us here today Sandra Boek Werness, who is the Executive Director of the Global Autoimmune Institute. She's taken on this role because of her personal experience with autoimmune disease and misdiagnoses. She resonates deeply with people who have experienced medical gaslighting. The Global Autoimmune Institute is making great strides in its mission to address many aspects in need of improvement and advancement. GAI funds clinical research studies, basic scientific research, multidisciplinary practice of medicine, education, and provides free education to the community. So truly, it is a wonder to have you here with us, and I will turn it over to you.
Thank you so much, Shannon. We really seek to meet the needs of people with autoimmune disease, and we really want your input and your ideas as well. We try to put our arms around everyone with autoimmune disease and spread the love and, of course, increase understanding and raise awareness, as well as funding basic and clinical scientific research. We have a website, too, that I want to draw your attention to, which is the autoimmuneinstitute.org. We have articles. We have a COVID and autoimmune disease timeline. We digest peer-reviewed scientific research articles so that you can know what the latest is that's coming out, in particular about autoimmune disease and COVID. And we have articles and resources. We recommend books, such as, of course, The Invisible Kingdom, which is marvelous. And we are very actively engaged in social media at Autoimmune GAI. We have a summer internship program for public health students to introduce them to autoimmune disease and inspire them to choose a career in this area. And we also feature really beautiful stories, very inspiring of people by people who are living with autoimmune disease and having very, very distinctive and very important experiences to share. So this is about clinical research, and it's a very important subject because we all need to participate and as often as possible. Without that, we will be less represented. And in fact, of course, it's really critical when it comes to diversity and inclusion. And that was so very beautifully addressed today by Dr. Duran. And so in fact, I hope everyone has seen that because that was especially enlightening, I felt, and inspiring. Today I will be focusing on studies with people today, with humans. Obviously, there are studies, of course, with animals, but today I'll just address with people. It's a very exciting time in autoimmune disease. Congress is recognizing that NIH, National Health Institute, or Institute of Health, needs a strategic NIH-wide research plan and coordination across institutions and centers to optimize the collaboration in autoimmune disease. And it's called for the creation of a new Office of Autoimmune Disease Autoimmunity Research directly in the Office of the Director of NIH. So this is a very important change in our country and important recognition of the severity and the high incidence, the high rates of autoimmune disease. And I'm happy to see this, and it represents a lot of progress because one of the hardest parts of developing knowledge and information in science is the exchange of information and the collaboration of scientists and physicians to compile all of the information that they have. So to find all of the connections, to get the hint of what they need to do next. That's what clinical research studies are all about. So why are they important? And why are they important for autoimmune disease? What kinds are they? How do they work? Are you wondering, should I try to get into one? Would that help me or help other people like me? How do I find one? What are the possibilities? What do I need to do and for how long? Are they safe? What happens if they're not? How can I tell a good study, and what do I need to pay attention to? So clinical research is important, especially in autoimmune disease. Studies directly impact medical practice, diagnosis, and treatment. Doctors and patients do their best to investigate and to learn about the varieties of illnesses they encounter. Their goals are to help the patients or to find answers they aren't finding from their doctors. They need to be able to know better what to do, what to expect, how to connect the dots, as there are so many factors to consider. So many of us look now to published clinical research studies for guidance. So clinical research gives us answers, eliminates some red herrings, or just gives us clues about what to look for, what kinds of connections can we or should we be making. Clinical research can be patient and family driven and funded and supported by academic institutions, hospitals, and the United States government, or by nonprofits with the desire to improve diagnosis and treatment. Here's an example. Global Autoimmune Institute funded and helped propel the Children's National Hospital in Washington, D.C. to establish a multidisciplinary clinic in celiac disease with an ongoing clinical research study to determine how many of the children with celiac disease also had and have its ongoing neurological disorders such as headaches. And we need more of that. We need a lot more of that. We need a lot more multidisciplinary practice of medicine. And so I like to see Aila promoting this and actively engaged in this. It's exactly what we need. And it's not necessarily so difficult for these kinds of practices to, in fact, engage in clinical research studies too. And it's important that they do, in fact. This clinic also brought to light symptoms that had not been openly or perhaps ever discussed as part of having an autoimmune disease, such as emotional volatility, rages, irritability, and cognitive difficulties such as memory, foggy brain and ADD, anxiety, depression, and eating disorders. These are all very familiar to all of us who have had any experience with autoimmune disease, but they're sort of it's newly emerging, or it's newly out in the open that these things are very common and exist and are serious problems. The clinic also explores symptoms that are a little better known, such as chronic fatigue, and provides psychosocial support for the children in their day-to-day lives, lifestyle and medical education for the children and their families, and a support group. It's the gold standard in treating all autoimmune disease. It's a great model, and the world is taking notice. As we know, there's a lot that remains to be understood about autoimmune disease. Awareness is just starting to spread more widely, helped by the world's new focus on long COVID, the symptoms that arise after someone has COVID, such as sleep disruption, fatigue, foggy brain, which stem from problems with the immune system, likely, and maybe closely related to autoimmunity. This is being thoroughly and comprehensively studied, both in the laboratory and in clinical research studies in many parts of the world, including in the US. Here's some examples. There are great clinical research studies in autoimmune disease described, for example, in Nature's Outlook on Autoimmune Disease, which we sponsored, and it's the first one that they've ever done, and it was published last July. If you want a free copy, then you can ask us, and we'll be glad to send you one. It's really beautiful. It's very informative. And you can write us at info@autoimmuneinstitute.org. So here are some examples just taken from that, and from some other places too. So our gut microbiome is integral to our health. And we know that microbiomes of those with autoimmune disease are different from healthy individuals. Therefore, it's a hot topic in clinical research. The article, A Gut Feeling, tells us about two groups of people with inflammatory bowel disease who are given an immune suppressant drug, and their gut microbiomes were studied. They found that those who did not respond to the medication had more pro-inflammatory microbes. So the long-term goal of this and other studies is to help show the way to create therapies that will be tailored to the microbiome and or the genetic code of each individual. In the importance of sex, it's noted, or it's explored, why women have autoimmune disease much more frequently than men. For this, clinical research is looking at genetically determined hormonal and immunological differences. Many clues have come to light, such as that pregnant women with MS experience a 70% relapse rate. So there are a lot of clues coming in from all kinds of different directions, and we need to keep them coming. Cracking the code of autoimmunity shows how examining the genetic code of thousands of people has allowed scientists to narrow down the regions of our genome that are associated with having autoimmune disease. Collectively, this information on genetic variations gives us a framework of the basic biology of autoimmunity and the genetic risk factors. Additional clinical research will allow us to zero in on many of these variations to test their impact on the likelihood of having autoimmune disease and even which ones. Autoimmune disease, as you know, arises from a combination of genetic predisposition, in other words, the genes we each have individually that are associated with a higher rate or incidence of autoimmune disease, and environmental factors that disrupt the immune system's ability to distinguish between a pathogen, such as a bacteria or virus, and our own tissues and cells. Here's a great one. Here's a great clinical research study that just came down. Scientists have recently discovered how to detect IBD, irritable bowel syndrome, with a sweat detector. This is great because it could be easier for people than having regular blood draws to get tested. So we'll keep an eye out for this and see if it gets put on the market, and whether also it can detect other diseases. We'll have to see. So our goals. Well, let's see. I'll get to that in a second. So why is clinical research important overall? We still need to know the causes of autoimmune disease. We usually say environmental, which right now is mostly looking at viral and bacterial infections, such as EBV, Epstein-Barr virus, GB, which is Guillain-Barré, coxsackie, herpes, and now COVID viruses. Why do some people get autoimmune diseases and others do not? What are the specific genetic differences, and what can we do to cure it, and at least treat it? Can we use successful treatments in, say, for example, rheumatoid arthritis and apply them to other situations? Can we try treatments that might be effective across a broader spectrum? Many of these things have yet to be proven or tested. We need to also be able to better identify autoimmune disease and to be familiar with all of the symptoms that can arise. And we need to know and find out which autoimmune diseases are likely to be found with each other. So as to be able to thoroughly and fully identify and diagnose all of the different disorders and autoimmune diseases that one person may have. We need to develop tests that are easier, more broader, detect more things, and that are less invasive. So clinical research is especially important in the United States, where our patient data is not accessible. We don't have a centralized database to compile essential information about people and their illnesses in their medical records. So the spreading of information is even more reliant on published information channels such as scientific and medical journals. Doctors and scientists learn from each other at conferences, on online fora, and in other settings, but translating their shared experiences and hypotheses to real data that can be trusted and used to make progress is done primarily through clinical research studies. So how do you find published articles that relate to what you have or what you are experiencing? If you want to learn more, if you want to get more of an idea, or try to find a way to engage your physicians or others so as to further not only your own understanding, but also to give people material on what might relate to yours. The best source for relevant articles is PubMed. You can also use Google Scholar, that's good. PubMed, as you probably know, is the free NIH government website, which is accessible to everyone. You enter your search terms and you read the first part of the articles. That's the best thing to do as a layman, which I am too, by the way, a layperson, and which summarizes subject. The first part of the article is known as an abstract. It summarizes subject, what was done, how it was done, and the results they found. And I can talk more later if we have time about that, to give you a little bit more detail to learn how to carefully sort of understand and what to look for. You can also look at some of the major scientific journals, such as Nature, Science, the Journal of the American Medical Association, the New England Journal of Medicine, the Lancet Journal of Autoimmunity, and others. So how do clinical research studies work? Doctors or scientists, often researchers or practicing doctors who also do research, have an idea they want to test. They write a plan called a protocol. Other doctors and or scientists review it, and that's called peer review, to make sure that it makes sense and it's worth doing. Based on what we already know relating to that idea, a team is formed then and gets funding. The plan is approved by an ethics committee. Hospitals agree to help by recruiting patients. The patients who want to participate and who fit the study's eligibility criteria agree. Of course, it's all very carefully done, and important rules of scientific inquiry and patient privacy are followed. Should I try to get into one? Maybe. I think the best way to think about this is that it is possible that whatever is being tested might help you, and if not, you are helping others. Autoimmune disease can run in families, so the results may help your children or other relatives or friends, as well as our overall community. It's also a good way to focus on yourself and what you're experiencing and to give to others. It can be inspiring, feel encouraging, validating, and even empowering. How do I find one? The best way is to talk to your specialist to see if they know of any clinical studies being done that relate to your diagnoses, symptoms, or other factors. You can also look at the NIH website, which lists many clinical studies. It takes a while to go through, but that's a very good source for ongoing studies. And then you can apply through their links. Well, what do you have to do in a clinical research study? That depends. They are all different. It depends on what they're trying to accomplish. Are they testing a new treatment, such as a medicine, a new test, such as screening or detection? Who are doing the study? Where are they located or centering their study? How long will it go on? How frequently will you need to be in touch, go in person, or is it conducted remotely? And what follow-up, if any, will be needed after the study? You may need to give saliva or blood or other biosamples to be tested at regular intervals. You may need to take medicines and report how you feel. You may need to be given certain tests such as an MRI or an EEG. You may decide to enroll in an observational study and record certain aspects of what you eat or your activity level and how you feel in order to demonstrate how certain lifestyle variables affect your health. Or you may be asked to answer questionnaires about the quality of life or other important aspects of what you may be experiencing. These are important too. These questionnaires compiling information. It sheds light on a lot of how we're feeling and experiencing. Are they safe? Yes, because trials are stopped immediately when harmful effects are detected at a statistically significant level. They determine at the outset. Or when it becomes clear that one control group could benefit from what is being given to the other control group, because it obviously works so well, so everyone will benefit. So they stop the trial and they so that they can start giving it to everybody. Am I allowed to drop out if I no longer wish to participate? Yes. What else can I do in connection with clinical research? Well, you can help fund more clinical research studies. There's a lot of funding needed. You can donate to institutions planning or already running these studies, or to organizations that fund them. You can donate to the Global Autoimmune Institute, as we're committed to funding carefully vetted clinical research studies. For example, we are currently considering several proposals, including Johns Hopkins Medicine, and soon we are. And we're also, right at this time, we're funding a study at Boston Children's Hospital, and I'll talk a little bit more about that later, because it's pretty exciting. So here's a question for you all. Has anyone ever been involved with a clinical trial, and what was your experience? Did it leave you with any questions that I've not touched on so far, and what are they? I'll try to answer them today. So what kinds of clinical studies are there? There are observational studies. These can get the ball rolling. Think of, by trying to understand situations in order to find associations that might seem worth developing a hypothesis to test. Just as an example, because there are many, physicians sometimes notice an association, for instance, between celiac disease and dermatitis herpetiformis, painful and very unsightly skin condition, and wants to compile information about patients having similar medical histories in some ways. It's just an example, but there are many, many things that would be great to explore in further detail. So the physician might write a detailed description of what one or more patients are experiencing, or you might have another kind of observational study, as I mentioned before, to report dietary intake or sort of behavioral or other emotional responses to certain situations or certain lifestyle variations or modifications. There are also case studies or case series. They look at data from an ongoing or a past study and analyze it in a different way. They look at different variables. So there are a lot of longitudinal studies going on, studying people over the course of many years or even a few years, but then that are studied for a particular reason, but they have biosamples and they have other data that might be understood or interpreted or explored to come up with other clues of other things that could be very valuable. There are ecological studies, and that's a comparison of a rate of a disease or condition for groups of people, such as autoimmune disease, of course, the difference between how frequently males and females have autoimmune disease, and whether sex is also associated with levels of severity of disease, because that's a hot topic too. Or a cross-sectional study, which explores possible links between certain factors in development of disease. If something intriguing shows up, it may be carried on to a cohort study to look at groups of people over a period of time, or a case control study, which is the opposite of a cohort study. It compares, for example, a group with a disease with a group of people who do not have it and investigates whether those in each group were exposed to risk factors. This is just by way of an example. An example of this could be comparing people who have MS with those who have not, and comparing exposure, say, who had the Epstein virus and when they had it in their lives, or looking at their EBV blood levels over time, and looking into the severity and length of time since they contracted the EBV or the febrile illness. That's an example of certain things that are studied and need to be studied a little bit further too. There are prevention trials to see whether a certain treatment can prevent disease. And there are screening trials to see if you can catch diseases early or more effectively. Here's an example of a screening study. Global Autoimmune Institute is currently funding a study of 12-year-old blood samples taken of children with a certain autoimmune disease, like celiac disease, to see if other autoimmune diseases can be detected, and if so, which ones? As we know that autoimmune diseases often coexist. That is, if you have one, you have more of a chance of having or developing others. This study is to try to help figure out when other autoimmune diseases may begin, if any can be detected, and if so, are they distinguishable from the first autoimmune disease? How so? How different are they? What coexists? As a rule, we don't always know for every single autoimmune disease how long it takes to develop it, when it starts, or much less exactly what the cause is. So, gastroenterologists at Boston Children's are checking to see whether we can find early development of other autoimmune diseases in childhood. So let's see. So clinical trials are usually for finding new ways to prevent, detect, or treat disease. Yes, Rory, did you want to say something?
Yeah, I just wanted to, I'm really enjoying the talk. I just wanted to be mindful of time on the session and Yeah, no, just gonna close out once you're finished wrapping up, but just wanted to kind of be mindful of the time, but that's all. Sorry to
Thanks,
interject.
yeah. There's so much to tell you.
I
all
know
about.
there's so much work to do in this space. It's been
There's so much to
amazing.
tell you. Yeah,
And
I
I
see
think,
what you mean.
yeah, I think
Yeah.
you just want to closing comments, and we can follow up with a bunch of this information and links, and we're gonna pull together a whole resources page from everything we've learned.
Yeah, that's fantastic. Yeah, there's a lot more than really I would love everybody to know. So I would have to say that let's see. So I'll have to skip over, So I would say that first of all, I'm so glad to be here. I'm inspired by you all. I think it brings us all together for some very important in education and solidarity. And to sum up clinical research, there are important questions yet to be answered about autoimmune disease. And fortunately, there are many brilliant people and hardworking scientists and physicians and many others working to solve the remaining very complex pieces of the puzzle. It's the key to increasing scientific and medical knowledge that we can use to treat and to cure autoimmune disease. So we welcome you all to get involved with us, to go to our website and to work with us and join us in our efforts. And I hope you all have the opportunity and the privilege of joining a clinical research study someday.
I love it. Thank you so much, Sandy. These were amazing words, and we'll definitely send out more information about the Global Autoimmune Institute. I just want to say a big thank you to all of our speakers today. It's been a fantastic event, and the engaged discussion on the chats. We look forward to connecting with you all in the Aila Health app, in the broader autoimmune community, and really try to keep this going, right? Like, coming together is what's going to shine a light on what we're all doing here. And to kind of echo what Megan said at the beginning of the day, really kind of pull this invisible kingdom of autoimmune warriors and chronic illness warriors and drive change, which is what we're all hoping for. So it was so powerful speaking and working with you all. I am so humbled to be a part of this community, and I just look forward to continuing to work with you all to make it better and learn from one another. So thank you all.